Prostate cancer is the second most commonly seen type of cancer in men. Why does prostate cancer occur?
Okay, according to the global data, prostate cancer is almost the second most common cancer, but according to the United States data, this year prostate cancer became the most common cancer in men in United States. So probably the world data is also will update it within the next year, so it will be the most common cancer in men. But the problem is we do not have any idea why the prostate cancer is occurring in men.
How often do men need a prostate checkup? What symptoms do they need to look out for?
Okay, prostate cancer checkup is something we use as a screening tool for prostate cancer. So what is recommended right now is if someone, a man, has a familial history, which is if his father or his brothers have prostate cancer, he has to be checked in his 40s with PSA level and physical examination by a uro-oncologist. But if there are no risk factors to develop a prostate cancer, then we recommend them to start checking their PSA levels in their 50s, and according to their PSA level, we can modify their routine control checkups.
What are the current treatments of prostate cancer? Is there a non-surgical option or surgery is must in most cases?
Okay, as in all cancers, first we have to evaluate the patient and we have to stage the patient. If he has a localized disease, local prostate cancer, and if the grade of the tumor is low, there are many options. We even follow most of these patients who have localized disease and who have a low grade disease. But with advanced disease, the options are either surgery or radiotherapy. But when there is a metastatic disease, then all the treatments are different, where we have to treat these patients with systemic therapies.
You both can perform laparoscopic and robotic surgery for prostate cancer. How do these treatment modalities differ from each other?
In theory, they are the same modalities. In both surgeries, we perform laparoscopic surgery, but in the robot-assisted laparoscopic prostate cancer treatments, or in short, robotic surgery, we use robot instead of our laparoscopic tools. In robotic surgery, robot will adapt to the patient, and we are performing this surgery using a console which is next to the patient. In laparoscopic surgery, we have to stand by the patient and we have to use the laparoscopic tools. That's the main difference. And to be honest, robotic surgery is easier for the surgeon to perform because laparoscopic surgery, the only laparoscopy or the sole laparoscopic surgery is not so ergonomic for the surgeon.
We know that prostatectomy has some side effects, including urinary incontinence and erectile dysfunction. Do new treatment modalities minimize these side effects, or are there specific additional or supplementary treatments to treat these side effects?
Okay, when we perform prostate cancer surgery, our main goal is to resect the whole cancer tissue out of the patient's body. And not all the patients are the same. Not all the cancer tissues are the same. Not all the prostate organs are the same. So our main goal is to preserve the nerves and the vascularity of those tissues which are critical for the continence and for the erection. So if we are able to preserve these structures, then the risk of incontinence and the erectile dysfunction is extremely low. But for the sake of the cancer surgery, we might resect these tissues together with the prostate organ. So in those patients, these potential side effects incontinence and erectile dysfunction might occur. But if there is incontinence, we have many treatment modalities, including reconstructive surgery. When there is erectile dysfunction, again, we have many medical treatments. We can also perform some surgical approaches in order to become erectile again.
Could you please give some advice to the audience on nutrition, exercise, supplementation to maintain health and reduce the risk of cancer?
The main message should be balance. So in the modern life, we eat more. We do not do exercise that often. So we have to eat less. We just have to eat when we are hungry. We don't have to eat when for fun, for socializing. We just have to eat when we are hungry. So we have to maintain our body weight within the limits, which is proportional with our height. So for physical exercise, we really have to move. Instead of moving, we are just sitting, we are looking on the screens, and the final result is we became obese and we became unhealthy. That's the main thing. We do not have any magical or miracle tools to be healthy. We just have to move and eat less.
Thank you.